Important information. 10 subtle pancreatic cancer symptoms, often overlooked. Early detection offers the best chance for successful treatment. Pancreatic cancer, a formidable disease often detected only in its advanced stages, is a significant health concern. However, early detection is possible through recognizing subtle warning signs. This video highlights 10 often overlooked symptoms, empowering viewers with the knowledge to seek timely medical attention, potentially saving lives. Learn how to identify these indicators and contribute to earlier diagnosis and improved outcomes. 1. Jaundice. Symptoms include jaundice, yellowing of the skin and whites of the eyes, dark urine, often described as tea-colored, and pale or clay-colored stools. Intense and persistent itching is also common. This is caused by a buildup of bilirubin in the blood. Bilirubin is a yellow pigment produced when the body breaks down old red blood cells. Normally, the liver processes bilirubin, mixing it with bile for excretion in the stool. However, a blockage in the bile duct, often caused by a tumor in the head of the pancreas, where the pancreas meets the bile duct, prevents bilirubin from being eliminated, leading to its accumulation in the bloodstream and jaundice. Pancreatic head tumors are particularly prone to causing bile duct blockages due to their proximity to the bile duct. With appropriate treatment, a positive outcome is achievable. Early onset. Jaundice is often the first noticeable symptom in individuals with pancreatic cancer, particularly if the tumor is located in the head of the pancreas. This makes it one of the few early detectable signs before the disease spreads widely. Potential for misdiagnosis. Many associate jaundice with more common ailments like hepatitis, gallstones, or liver problems, leading to delays in diagnosing cancer. Associated symptoms. Jaundice frequently accompanies itching, dark urine, and pale stools, clear indicators warranting liver, bile duct, and pancreatic function tests. Consequences of ignoring symptoms. Silent progression. If overlooked, pancreatic cancer can progress undetected until late stages, significantly reducing the chances of successful treatment. Liver and bile duct damage. Prolonged bile duct obstruction can cause irreversible liver damage. Differentiating pancreatic cancer, jaundice from other causes. Hepatitis or liver disease, often accompanied by right upper quadrant pain and infectious symptoms like fever and fatigue. Gallstones typically cause intense, episodic pain in the upper right abdomen. Pancreatic cancer rarely causes severe pain initially. Instead, jaundice presents subtly and persists. Recommended action. Upon noticing jaundice, promptly seek medical attention. Undergo blood tests and imaging studies such as ultrasound, CT scan, or MRI to examine the pancreas and bile ducts. Note accompanying symptoms. If jaundice appears alongside weight loss, itching, and changes in stool urine color, a serious pancreatic issue is highly probable. 2. Unexplained weight loss symptoms. Significant and rapid weight loss, more than 5% of body weight within 6 to 12 months, without dietary changes or increased exercise. Clothing becomes looser and noticeable physical weakness develops. This may be accompanied by fatigue, loss of appetite, or digestive symptoms. Causes. Malabsorption. The pancreas produces digestive enzymes that break down and absorb fats, proteins, and carbohydrates. In pancreatic cancer, these enzymes are reduced or dysfunctional, leading to malabsorption syndrome. Food is not properly digested, resulting in essential nutrient deficiencies. Early satiety. The tumor may put pressure on the stomach, causing the patient to feel full quickly even after consuming small amounts of food, leading to reduced calorie intake. Increased metabolism due to cancer. Cancer cells increase the body's metabolic activity, burning more energy than usual to sustain itself and combat the disease. Loss of appetite and altered taste. Cancer can affect hunger signals from the brain or alter taste preferences, causing patients to eat less. We are optimistic that with early detection and appropriate treatment, positive outcomes are achievable. Common yet overlooked. Weight loss is a prevalent symptom of cancer in general, often disregarded as it can be mistaken for stress, lifestyle changes, or other conditions such as diabetes or thyroid disorders. Early systemic indicator. Unexplained weight loss signals a serious underlying health concern, such as pancreatic cancer. Impact on overall health. Rapid weight loss not only weakens the body but also compromises recovery. Should cancer be diagnosed and treated? Diabetes, often accompanied by symptoms such as thirst, frequent urination, or fatigue. Hyperthyroidism. may include restlessness, rapid heartbeat, or excessive sweating. Pancreatic cancer. Weight loss is frequently accompanied by other symptoms such as abdominal pain, steatorrhea, or loss of appetite. Consequences of ignoring symptoms. Silent progression. Left untreated, pancreatic cancer can progressively damage the digestive system and surrounding tissues, leading to further debilitation. Severe malnutrition. Prolonged weight loss and nutritional deficiencies can result in cancer cachexia, reducing treatment tolerance and quality of life. Recommended steps. Consult a physician. If you experience a weight loss exceeding 5% of your body weight within 6 to 12 months without an apparent cause, a comprehensive health check is recommended, including pancreatic function tests, ultrasound, or CT scan. Monitor accompanying symptoms. Pay attention to abdominal pain, digestive changes, or other bodily signs. Unexplained weight loss is never normal. It's a signal from your body that something serious may be happening, including potentially pancreatic cancer. Early detection through timely checkups significantly increases the chances of successful treatment. Key message: pay attention to your weight. Rapid, unexplained weight loss shouldn't be ignored, as it can be an early indicator of serious conditions like pancreatic cancer. Listening to your body and acting promptly will safeguard your health and the well-being of your loved ones. 3 persistent abdominal pain symptoms. Pain typically begins in the upper abdomen, often in the middle or left side. This discomfort may radiate to the back, creating a deep, aching sensation. Pain often worsens after eating or when lying down. Initially, the pain may be mild, but over time it can become persistent, intense, and unrelenting. However, with proper diagnosis and treatment, significant pain relief is achievable. Causes: increased pressure from a tumor. A growing pancreatic tumor can put pressure on nearby organs, such as the stomach, liver, or intestines, as well as compress surrounding nerves. Spread to nerves and surrounding tissue. As cancer progresses, it may invade the nerves around the pancreas, causing chronic pain that often radiates to the back. Digestive disturbances. Blockages of the bile or digestive ducts caused by the tumor can lead to feelings of fullness, indigestion, and postprandial abdominal pain. These digestive issues are often manageable with appropriate medical intervention. While abdominal pain is a common and easily misunderstood symptom, often associated with conditions like gastritis, peptic ulcers, or digestive disorders, leading many to ignore it or self-medicate, delaying diagnosis, pancreatic cancer presents a distinct progression. The pain associated with pancreatic cancer intensifies over time, unresponsive to typical analgesics, and is notably severe at night or when lying down. When abdominal pain is accompanied by weight loss, changes in stool color, or jaundice, it's a clear indication requiring immediate medical attention. Differentiating pancreatic cancer pain from other causes is crucial. Gastritis or peptic ulcers typically cause pain in the upper abdomen, relieved by eating or antacids. Acute or chronic pancreatitis may radiate to the back, often accompanied by fever, nausea, and elevated blood amylase or lipase levels. In contrast, pancreatic cancer pain is persistent, dull, gradually worsening, and unrelieved by posture changes or standard pain medication. Early detection is key. Prolonged abdominal pain could indicate cancer spreading beyond the pancreas, invading nearby organs and nerves, complicating treatment. However, with prompt diagnosis and treatment, the impact of this condition on quality of life, including sleep, appetite, and daily activities, can be significantly mitigated. Seek immediate medical attention for persistent abdominal pain, especially if accompanied by other symptoms such as weight loss, jaundice, or changes in bowel habits. Necessary diagnostic tests, including abdominal ultrasound, CT scan, or MRI, can detect abnormalities in the pancreas or surrounding organs. Monitor the progression of pain. If it intensifies over time and doesn't respond to standard treatment, further specialized tests are needed to rule out pancreatic cancer. Importantly, don't ignore persistent abdominal pain, particularly if it doesn't subside with typical pain relief or radiates to the back. This is your body signaling a potentially serious issue. Prompt medical assistance allows for early detection and timely treatment, offering the best chance for a positive outcome. Persistent abdominal pain isn't merely a minor issue, it could be an early indicator of pancreatic cancer. Pay close attention to any persistent pain, especially if accompanied by other symptoms. Early detection and treatment can significantly improve your health outcomes. Listen to your body and seek timely medical attention. 4. Digestive issues. Symptoms may include frequent nausea or vomiting, diarrhea, constipation, or unusual changes in bowel habits. Stools may appear pale, have an unpleasant odor, or be oily, steatorrhea. You may experience fullness or indigestion after eating even small amounts. Causes include pancreatic insufficiency. The pancreas produces digestive enzymes to break down and absorb nutrients from food. Pancreatic cancer impairs this function, leading to malabsorption. Digestive blockage. Tumors can compress or block ducts, such as the bile or pancreatic duct, preventing the normal movement of food and digestive fluids. Bile flow disruption. Improper bile secretion, due to bile duct blockage, hinders fat digestion, resulting in oily stools or steatorrhea, often overlooked manifestations. Digestive symptoms are frequently attributed to less serious causes, such as indigestion, poor diet, or stress, delaying the detection of pancreatic cancer. Direct impact on quality of life. Individuals experiencing persistent digestive issues often lose their appetite, leading to weight loss, malnutrition, and general weakness. A key indicator of malabsorption. Pale, greasy stools, steatorrhea, strongly suggest insufficient digestive enzyme production or bile duct obstruction by the pancreas, differentiating pancreatic cancer from other causes. Indigestion. Often caused by dietary indiscretions, it's typically short-lived and resolves with dietary adjustments. Acute chronic pancreatitis presents with severe abdominal pain, nausea, and elevated blood pancreatic enzymes. Pancreatic cancer. Persistent, worsening digestive problems accompanied by symptoms such as jaundice, unexplained weight loss, or persistent abdominal pain. Consequences of ignoring symptoms. Severe malnutrition. Impaired nutrient absorption leads to vitamin and mineral deficiencies, weakening the immune system, reducing recovery capacity, and diminishing quality of life. Cancer progression. Without timely treatment, tumors can grow, increasing blockages and damaging the function of digestive organs. Early diagnosis and treatment offer the best chance for positive outcomes. Consult a physician if you experience any symptoms such as pale stools, steatorrhea, or persistent indigestion. Tests such as pancreatic function tests, ultrasound, or CT scans may be necessary. Pay close attention to associated symptoms. If digestive issues are accompanied by weight loss, abdominal pain, or jaundice, the possibility of pancreatic cancer is significantly increased. Specific tests include stool analysis to assess fat absorption and pancreatic enzyme tests to determine functional impairment. It is crucial not to disregard persistent digestive problems, especially unusual changes in stool color or consistency, as these can be direct indicators of pancreatic cancer. If you or a loved one experiences these symptoms, seek medical attention promptly to ensure the condition doesn't worsen. Digestive problems can manifest in many minor illnesses, but when persistent and accompanied by unusual changes in stool and overall health, they may be an early sign of pancreatic cancer. Listen to your body, heed even the smallest changes, and seek early medical help to maximize the chances of successful treatment. Loss of appetite symptoms. Prolonged and unexplained loss or decrease in appetite, feeling full quickly even after consuming small amounts of food. Significant weight loss due to insufficient caloric intake may be accompanied by nausea, bloating, or postprandial discomfort. Causes. Tumors pressing on the stomach or nearby organs. Pancreatic tumors, for example, can compress the stomach, leading to early satiety and reduced appetite. Digestive dysfunction. Pancreatic damage reduces digestive enzyme production, impairing food breakdown and causing indigestion or nausea. Psychological and endocrine effects of cancer. Cancer cells release chemicals that can alter the body's hunger and satiety signals to the brain, resulting in appetite loss. Changes in taste perception. Cancer and its treatments, such as chemotherapy, can alter the taste of food, making it unappealing or unpleasant. Often overlooked, a loss of appetite is frequently attributed to stress, fatigue, or simply changing tastes, leading patients to delay seeking medical attention. However, this symptom, along with other systemic effects, can be a significant indicator of pancreatic cancer, reflecting a general weakening of the body due to impaired digestive and metabolic function. Fortunately, early intervention can significantly improve outcomes. Prolonged appetite loss results in rapid weight loss, malnutrition, and a weakened immune system, making the body more vulnerable to illness. Addressing this symptom promptly can help maintain overall health and well-being. Stress or depression, often accompanied by sadness and loss of interest in activities, potentially affecting appetite. Mild digestive disorders, loss of appetite usually lasts only a few days and improves with treatment of symptoms such as indigestion or bloating. Pancreatic cancer, persistent and worsening loss of appetite, accompanied by other symptoms such as unexplained weight loss, abdominal pain, or persistent digestive problems. Consequences of ignoring symptoms. Cancer cachexia, prolonged loss of appetite, leads to severe malnutrition, muscle and fat loss, weakening the body and hindering recovery during treatment. Unhindered cancer progression. Without attention and treatment, pancreatic cancer may continue to develop and spread undetected. Early diagnosis and intervention offer the best chance for successful treatment and improved outcomes. Consult a physician promptly. Persistent loss of appetite lasting several weeks, especially if accompanied by weight loss or fatigue, warrants immediate medical attention. Comprehensive diagnosis. Imaging tests such as ultrasound, CT scans, or MRI will examine the pancreas and surrounding organs. Blood tests will assess nutritional status and liver function. Dietary monitoring. Record food intake and associated symptoms to provide detailed information to your doctor. Crucial advice. Do not disregard prolonged loss of appetite. It can indicate serious health issues, including pancreatic cancer. Observe accompanying symptoms. Weight loss, abdominal pain, or poor digestion, when combined with appetite loss, necessitate immediate medical evaluation. Nutritional care. While awaiting diagnosis or treatment, maintain nutrition through small, easily digestible, energy-rich meals. Key message: prolonged loss of appetite, particularly without a clear cause, is not normal. It may be an early sign of pancreatic cancer or other serious conditions. Early detection and intervention are key to protecting your health and improving treatment outcomes. Listen to your body and seek medical assistance without delay. 6. Sudden onset of diabetes symptoms. The onset of previously undiagnosed diabetes, particularly in individuals over 50 or those without typical risk factors such as obesity, family history, or sedentary lifestyle, warrants attention. Diabetic symptoms include excessive thirst and urination, especially at night, fatigue, unexplained weight loss, and blurred vision. Causes: pancreatic dysfunction. Pancreatic cancer can damage insulin-producing beta cells, leading to elevated blood glucose levels and diabetes. Tumor presence. A pancreatic tumor disrupts normal pancreatic function, causing glucose imbalance. Tumor-secreted substances. Some pancreatic cancers release substances that interfere with glucose regulation, resulting in diabetes. Why is new-onset diabetes significant? It may be the first sign of pancreatic cancer. In many individuals, sudden-onset diabetes precedes other pancreatic cancer symptoms, making it a crucial warning sign. New-onset diabetes in older adults is particularly noteworthy. In those over 50, especially without pre-existing risk factors, this could indicate a pancreatic issue, including cancer. Atypical diabetes. Diabetes caused by pancreatic cancer is often difficult to manage conventionally and may progress rapidly. However, early detection offers the best chance for successful treatment. Type 2 diabetes typically manifests in obese individuals with sedentary lifestyles or a family history of the condition. Transient diabetes may result from factors such as infection, medication, or stress. Pancreatic cancer-related diabetes presents suddenly, often without prior history or risk factors, and may be accompanied by symptoms like weight loss, fatigue, or abdominal pain. Early detection is crucial. Untreated pancreatic cancer progresses insidiously. Sudden-onset diabetes can be an early warning sign, but prompt diagnosis is vital to prevent its spread and ensure effective treatment. Uncontrolled diabetes can damage vital organs such as the kidneys, eyes, and heart, further compromising health. If you experience sudden-onset diabetes, especially if you are over 50, lack risk factors, or experience symptoms such as weight loss, abdominal pain, or fatigue, consult a physician immediately. A comprehensive diagnosis should include pancreatic enzyme tests and imaging studies such as ultrasound, CT scan, or MRI to evaluate the pancreas. With regular monitoring and checkups, individuals diagnosed with diabetes can proactively manage their condition and address any potential complications. significantly improving their outlook. Don't underestimate sudden-onset diabetes. This isn't merely a metabolic issue. It could signal a more serious underlying condition such as pancreatic cancer. Monitor for additional symptoms. If diabetes is accompanied by symptoms like unexplained weight loss, jaundice, or persistent abdominal pain, consult your physician immediately. Key message: sudden-onset diabetes, particularly in older adults or those without known risk factors, warrants thorough investigation. It may be an early indicator of pancreatic cancer. Attending to your body's signals, acting promptly, and seeking timely medical attention significantly increases the chances of successful detection and treatment. Prioritize your health. 7 persistent itching symptoms. Intense, persistent itching of unknown origin. Itching often occurs without a rash or other visible skin changes, may be localized or widespread, and worsens at night, significantly impacting sleep quality and overall well-being. Causes: bile salt buildup in the blood. Pancreatic cancer, particularly when the tumor obstructs the bile duct, prevents bile from reaching the intestines. The resulting buildup in the bloodstream irritates the underlying nerves, causing intense itching. Bilirubin involvement. Bile duct blockage also elevates bilirubin, bile pigment levels, leading to jaundice, itching, dark urine, and pale stools. Systemic inflammation. Cancer can trigger inflammation throughout the body, contributing to itching without visible skin lesions. Why is itching a crucial sign? Early, often overlooked symptom. Itching is frequently mistaken for common issues like allergies, dry skin, or weather changes, delaying pancreatic cancer detection. Indicator of bile duct obstruction. Itching accompanied by jaundice, pale stools, and dark urine strongly suggests bile duct obstruction, often linked to pancreatic tumors. Significant impact on quality of life. Severe, persistent itching causes discomfort, sleep deprivation, and negatively impacts both mental and physical health. Differentiating pancreatic cancer-related itching from other causes. Allergies or dry skin, usually accompanied by rashes, redness, or flaking, and often improve with moisturizers or antihistamines. Liver or kidney disease. Itching from liver or kidney disease is typically generalized and associated with fatigue or edema. Pancreatic cancer. Persistent itching, unresponsive to typical treatments, often accompanied by jaundice, weight loss, and digestive changes. Consequences of ignoring the symptom. Pancreatic cancer progression. Itching can be an early sign of a tumor compressing the bile duct. Untreated, the disease may progress to later stages. Psychological and physical effects. Prolonged itching causes stress, anxiety, sleep disturbances, and diminished quality of life. Seeking medical attention for persistent itching. If you experience prolonged, unexplained itching, especially if accompanied by jaundice, dark urine, or pale stools, consult a physician immediately. Diagnostic testing. Liver function tests and blood bilirubin levels should be conducted. Ultrasound or CT scans may be necessary to examine the pancreas and bile ducts. Interim symptom management. While awaiting diagnosis, use prescribed anti-itch medication to alleviate discomfort. Important considerations. Do not disregard persistent itching. It could signal a serious underlying condition, such as pancreatic cancer or bile duct obstruction. Note accompanying symptoms. If itching occurs alongside jaundice or changes in stool-urine color, seek medical evaluation promptly. Key message. Prolonged itching, particularly when unexplained, can be an early symptom of pancreatic cancer. This is not merely a dermatological issue, but a crucial warning sign of a potentially serious problem. Early detection and treatment significantly improve the chances of successful outcomes and enhance quality of life. Listen to your body and seek timely medical support. 8 chronic fatigue symptoms. Profound, persistent fatigue, unresponsive to rest or sleep, exhaustion even with simple daily activities, reduced concentration, memory, and productivity, accompanied by general weakness and debility. Causes: impaired nutrient absorption. Pancreatic enzyme production is crucial for digestion. Damage from cancer impairs nutrient absorption, leading to energy depletion. Increased energy metabolism. Cancer accelerates the body's metabolic rate to combat the disease, resulting in higher than normal energy expenditure. Organ dysfunction. Pancreatic cancer affects the digestive system and liver, reducing the body's energy supply. Systemic effects of cancer. Cancer cells release inflammatory substances, impacting bodily functions and causing prolonged fatigue. Psychological and emotional factors. Anxiety and stress related to unexplained symptoms contribute to fatigue. Why is persistent fatigue a significant sign? A systemic manifestation of cancer. While common, persistent fatigue is often overlooked. In pancreatic cancer, it signals serious energy supply and utilization problems. In combination with other symptoms, fatigue coupled with weight loss, jaundice, or abdominal pain significantly increases the risk of pancreatic cancer and necessitates immediate medical attention. Significant impact on quality of life. Prolonged fatigue affects not only physical health, but also mental well-being, potentially leading to stress, depression, and reduced work capacity. Differentiating pancreatic cancer fatigue from other causes. Anemia, fatigue accompanied by pale skin, dizziness, and cold sensitivity. Sleep disorders, fatigue often associated with insufficient or poor quality sleep. Pancreatic cancer, persistent fatigue unresponsive to rest, accompanied by symptoms such as weight loss, abdominal pain, or digestive changes. Prolonged fatigue, persistent tiredness signals a serious underlying health concern. Without prompt investigation, pancreatic cancer can progress to later stages, reducing treatment options. Overall debilitation, prolonged energy deficiency and malnutrition increase susceptibility to infections and weaken the body's defenses. Recommended actions. Seek immediate medical attention. If you experience fatigue lasting more than a few weeks with no apparent cause, especially if accompanied by abdominal pain or weight loss, consult a doctor immediately. Testing and diagnosis. Undergo blood tests to assess liver and pancreatic function and nutritional status. Ultrasound, CT scans, or MRIs can examine the pancreas and surrounding organs. Nutritional support. While awaiting diagnosis, consume nutrient-rich, easily digestible foods to maintain health. Important advice. Do not ignore persistent fatigue. This is not a typical symptom of stress or sleep deprivation. It may indicate serious health problems, including pancreatic cancer. Regular monitoring and checkups. When prolonged fatigue accompanies other unusual symptoms, schedule regular health checkups. Key message. Unremitting fatigue despite rest is a warning sign. When this symptom appears with others, such as weight loss, abdominal pain, or digestive changes, be especially vigilant as it could be related to pancreatic cancer. Early detection and timely action are crucial for safeguarding health and maximizing successful treatment. Listen to your body and seek medical help when needed. 9. Unexplained blood clots manifestations. Blood clots may appear, commonly in the leg veins, causing deep vein thrombosis or DVT, with symptoms such as unilateral leg swelling, redness, warmth, or pain in the affected area. Or in the lungs, causing pulmonary embolism or PE, with symptoms such as sudden shortness of breath, chest pain, worsened by deep breaths, and less commonly, coughing up blood. Fatigue and weakness may also accompany these symptoms. Causes. Cancerous tumors release substances that increase the body's clotting ability, leading to blood clot formation. Systemic inflammation triggered by cancerous tumors also elevates the risk of thrombosis. Large tumors may compress nearby blood vessels, slowing blood flow and causing clots. Reduced mobility due to cancer-related fatigue or poor health contributes to increased thrombosis risk. Why are blood clots a significant indicator? Early, easily overlooked symptoms. Blood clots often precede other clear symptoms of pancreatic cancer, making them a crucial early warning sign. Immediate danger. If a blood clot travels to the lungs or other vital organs, it can cause a pulmonary embolism, potentially fatal if not treated promptly. Cancer association. Unexplained blood clots are a potential indicator of cancer, particularly pancreatic cancer, differentiating pancreatic cancer-related clots from other causes. Post-surgical or traumatic clots often follow recent injury or surgery. Cardiovascular disease-related clots are usually associated with a history of heart disease, obesity, or high blood pressure. In contrast, pancreatic cancer may present with unexplained blood clots in individuals without cardiovascular history or other risk factors. High mortality risk. Deep vein thrombosis, DVT, or pulmonary embolism, PE, can be rapidly fatal if not promptly detected and treated. Pancreatic cancer's silent progression. The appearance of a blood clot may be the first indication of a developing systemically impacting cancer. Actionable steps. Immediate medical attention. Seek immediate medical care if you experience leg swelling, redness, or pain in one leg, or sudden shortness of breath. Comprehensive diagnosis. Undergo testing. Doppler ultrasound to check for DVT. Chest CT scan to detect PE. Test for cancer-related indicators, such as blood tests, ultrasound, or pancreatic CT scans. DVT treatment. Your physician may prescribe anticoagulants to prevent further clot formation. Cancer monitoring. If no clear cause for the thrombosis is found, thorough investigation to rule out cancer, particularly pancreatic cancer, is crucial. Important advice. Don't ignore blood clots. This is not merely a cardiovascular issue. It could be a subtle sign of pancreatic cancer or other serious conditions. Observe accompanying symptoms. If a blood clot appears alongside fatigue, weight loss, or abdominal pain, seek immediate specialized examination. Key message. The appearance of a blood clot of unknown origin is a serious warning sign requiring prompt attention, especially when accompanied by symptoms such as fatigue, abdominal pain, or weight loss. It may be an early indicator of pancreatic cancer. Timely detection and treatment not only reduce the risk of thrombosis complications, but also improve the chances of successful cancer diagnosis and treatment. Always pay attention to unusual bodily changes and seek medical assistance when necessary. 10 changes in stool and urine symptoms. Stool. Color. Stool may appear pale, white, or clay-colored. Consistency. Stool is greasy, foul-smelling, and floats on water, steatorrhea. Urine. Urine is dark, often resembling strong tea or cola, even with adequate hydration. These changes may be accompanied by symptoms such as jaundice, itching, or abdominal pain. Causes. Bile duct obstruction due to a tumor. A tumor in the pancreas, particularly in the head of the pancreas, can compress or obstruct the bile duct. This prevents bile, containing bilirubin, which gives stool its brown color, from reaching the intestines, resulting in pale stools and dark urine due to bilirubin accumulating in the blood and being excreted through the kidneys. Decreased digestive enzymes. The pancreas produces enzymes that aid in fat digestion. When these enzymes are reduced or not secreted due to a tumor, fats in food are undigested, leading to greasy, floating, foul-smelling stools. Bilirubin buildup in the blood. When bilirubin is not excreted in the stool, it accumulates in the blood, causing the color changes in both stool and urine. With prompt diagnosis and treatment, a positive outcome is achievable. Noticeable signs of pancreatic cancer include changes in stool and urine color. Pale stools and dark urine, directly related to digestive and hepatobiliary function, often indicate a serious liver, bile duct, or pancreatic issue requiring immediate medical attention. This change is rarely isolated and frequently accompanies jaundice, weight loss, or abdominal pain, aiding in the accurate diagnosis of pancreatic cancer. While liver inflammation or liver disease may cause similar symptoms, they often present with liver pain and elevated liver enzymes. Gallstones can also obstruct bile flow, but symptoms typically appear suddenly with intense right upper quadrant pain. In contrast, pancreatic cancer-related changes in stool and urine color usually develop gradually and subtly, alongside other symptoms like weight loss and persistent abdominal pain. Early detection offers the best chance for successful treatment. Pancreatic cancer often progresses subtly. Changes in stool and urine color may be the first indication of a compressing tumor. Early detection is crucial for successful treatment. Nutritional and digestive disturbances. Impaired nutrient absorption due to a lack of digestive enzymes can lead to malnutrition and debilitation. Recommended actions. Consult a physician promptly upon noticing any unusual changes. If you observe persistently pale stools or dark urine, seek immediate medical attention. Comprehensive diagnosis. Blood tests will assess liver function, bilirubin levels, and pancreatic enzymes. Ultrasound, CT scans, or MRI will image the pancreas and bile ducts. Dietary adjustments. While awaiting diagnosis, reducing dietary fat may ease digestive stress. Don't underestimate this change. While changes in stool or urine color can stem from various causes, persistent changes or those accompanied by other symptoms may indicate a serious underlying health issue. Regular monitoring is key. If you notice pale stools or dark urine becoming frequent, schedule regular health checkups. Key message. Alterations in the color and consistency of stool or urine are not simply digestive issues. They can be early indicators of pancreatic cancer or other serious hepatobiliary diseases. Early detection and prompt action significantly improve treatment outcomes. Pay attention to subtle changes in your body and seek medical attention when necessary. Early diagnosis offers the best chance for successful treatment. Prioritizing your health is paramount. Attending to your body's signals is an invaluable investment. While seemingly minor or unconnected, the symptoms discussed may offer crucial insights. Heeding your body's subtle cues is vital, as it often communicates important information. Sharing this video will contribute to broader awareness, a critical first step in preventative healthcare. We encourage you to subscribe for further health guidance. By proactively caring for your well-being today, you secure a healthier future.